Congratulations on your pregnancy, and thank you for choosing Sentara Williamsburg Regional Medical Center for your delivery. At our Family Maternity Center, our philosophy of care is anchored in improving health every day. We provide safe, individualized, holistic, family-centered care with respect to everyone's values and culture. This virtual tour is designed to show you where we'll collaborate on the birth of your child and to provide you with information on the care you and your baby will receive. Hi, I'm Donna Patno, Director of the Sentara Williamsburg Family Maternity Center. We look forward to working with you during your pregnancy, labor, and delivery at our center. When you're ready to head to the hospital, please remember your picture ID and your insurance card, along with your packed bag. You can find us located at 100 Sentara Circle in Williamsburg. You'll arrive at the hospital from Moortown Road and follow the signs to our visitor parking lot close by. Our main entrance is open from 6 a.m. until 9 p.m. each day. After hours, our emergency room entrance remains open. If you have a question about how to best enter the hospital when you're coming in, please see our brochure, Getting Ready for Your Birth, or call the Family Maternity Center at 757-984-8445. If you believe you're facing an emergency, please call your physician or go directly to our emergency department.
My name is Jessica, and I'm the team coordinator with the Family Maternity Center. You'll find us on the second floor, up the stairs, in the center of the lobby. One of my peers will greet you after you ring the bell to be admitted into our locked and secured center. We take security very seriously and only allow approved individuals into the area. After you register or finalize your registration, if you started the process prior to your labor, we'll evaluate your progress in triage. The amount of time you stay with us in triage can vary depending on where you are in labor or based on what other concerns brought you in to see us. As soon as it's appropriate, we'll guide you to your room. There, your nurse will ask you some questions, including your birth preferences. As much as possible, we want to follow your plan for your birth, as long as it is safe for you and your baby. The nurse will place you on a fetal monitor, draw blood, and start an IV for you. Your support person can relax on the sleeper sofa or watch TV while you're getting checked in. Of course, they'll be there to help support you through labor. You'll also find it convenient that each room has a private bathroom, a mini fridge, and individual control for the thermostat. You'll be able to stay in the same room for your labor, delivery, recovery, and postpartum care. This means that your precious time with your baby will not be interrupted, as you will never be moved to a different room after giving birth. Sentara is the only health system in the region to offer LDRP birthing suites, which is part of our commitment to providing family-centered approach to childbirth. For your hospital bag, we recommend packing shoes or slippers that are easy to slip into, personal care items, snacks, and going home outfits for you and your baby. Please also have your car seat base installed in your car and the car seat ready for your baby. In your room and nearby, we have special tools and care items that can help you. This includes labor and peanut balls, squatting bars, birthing mirrors, a birthing stool, nitrous oxide, and aromatherapy. If you'd like to move around during labor, we have mobile monitoring devices available. Some of our nurses are trained in spinning babies, and all of our nurses have training to support the mother with a medicated or unmedicated birth. We believe in immediate skin-to-skin, delayed cord clamping, and keeping that golden hour a special time for you and your new baby.
I'm Cherie, an OB surgical technologist in the Family Maternity Center. As we mentioned earlier, you can proceed through your labor, delivery, recovery, and postpartum care all in the same room. The only time we'll need to assist you to a new location is if you and your physician find a C-section delivery is best for you and your baby. We have an OR in our Family Maternity Center and additional operating rooms right across the hall. In most cases, your nurse can continue to work with you if you proceed to the OR. Immediately after the delivery, our nurses will assess your baby and make every attempt to give you time for skin-to-skin right in the OR or during your recovery time. We will talk about administration of vitamin K, the first hepatitis B vaccination, and erythromycin eye ointment. These help with blood clotting and fighting eye infections. We will screen your child for more than 50 diseases and disorders, as well as check for loss of hearing and congenital heart disease, based on the recommendations of the Virginia Department of Health. We also offer circumcision if appropriate. Our pediatrician will visit as well and help to care for your baby while you're in the hospital. We continue to prioritize safety after birth. We place a small tamper-resistant security tag on your baby's ankle. If there is any attempt to remove the tag or your baby is taken near an exit, the alarm will sound and our doors will all lock. We place 2 other special bands on your baby and one on you and your support person. We compare the numbers on the bands whenever we bring your baby to and from you.
Hi, I'm an RN in the nursery and my name is April Jenkins. My teammates and I keep a watchful eye on your baby and you during your stay with us. We are equipped to care for many common newborn issues right in our own nursery. If we identify any concerns that require special care beyond what we do in our intermediate care nursery, we collaborate immediately with one of several nearby Level 3 neonatal intensive care units. A Level 3 NICU is specially equipped and staffed to care for critically ill newborns. We are also here to give you a break from caring for your newborn if you are exhausted and need to catch up on your sleep after a very long or difficult labor. We strongly encourage rooming in, which has been proven to be best for sleep and care of you and your child. This means that in addition to having skin-to-skin time with your baby right after giving birth, he or she will also be in your room most of the time. We endorse this plan so that you can bond, learn your child's feeding cues, have the baby's first bath in privacy with our help, and breastfeed if you choose. Our nurses are well trained in lactation, and we have several international board-certified lactation consultants to help during the weekdays and some weekend hours. Breastfeeding is so important to us that we offer a free support group twice a week. We also have the area's first Mamava, a private standalone room for breastfeeding and pumping for anyone in our hospital.
While you're with us, we'll have your meals delivered to your room by one of our catering associates. Your support person can order dinner along with you. They can visit our cafeteria while it's open, or they can bring in your favorite food and drinks to store in your room's refrigerator for both of you to enjoy. You'll stay with us for anywhere from 1 to 3 days depending on your delivery, and if needed, we can provide you with flu and Tdap vaccinations prior to going home. Once we determine that you and your baby are medically stable and you've reviewed any needed education with your nurse, you'll be ready for discharge. Remember that even if you're an experienced mom, care for both you and your baby can change with time, and an education refresher would provide the perfect opportunity to update your understanding of care for you and your baby. Our birth registrar will work with you to complete your birth certificate and a paternity affidavit if you need this. Your baby's father will have to show legal identification if you need the affidavit completed. Also, you will need to bring a check or money order payable to the State Health Department for $12 for each birth certificate you order. We'll ask your support person to bring your car seat in the night before your planned discharge. By the way, some of our babies will require a car seat test before they can go home for their own safety. This can add a bit of time to the discharge process. The very last thing we do is remove your baby's ID band and security tag just before we walk you to our front door. Again, congratulations on your pregnancy. We look forward to working with you during your upcoming birth, and thank you for partnering with Sentara Williamsburg Regional Medical Center. We can't wait to meet you and your baby.